and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. My name is Chuck Jones. I'm with Synergy Broadcast, and as always, I'm joined by Fran London. Hi, Fran.
Hi, Chuck.
Fran is our regular guest, and that's for two reasons. Number one is she wrote the book called No Time to Teach. She is an expert on patient education, and she's also the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona. And so she's involved in patient education on a daily basis, not only with staff, but also with patients. And so we go to her as our expert on this. And Fran, today we are going to talk about how to teach without a handout. Let's say you don't have a pamphlet or a booklet. There's not a video available that you can help this particular patient prepare for discharge. So what do you do?
It actually happens more often than not because people have bizarre diagnoses or they're going home on new treatments that there's no handout for yet. So it really is important to make sure that they understand what's going on. And one key is that while you're talking to them, you can ask them to take notes. Ask them to write down, make drawings, whatever it is that helps them remember what it is you're talking about. And the process of doing that actually helps them process the information and understand it better.
Well, that makes a lot of sense. Now, of course, in a hospital environment, you get patients from every walk of life, and so you may get some that are perhaps their reading skills are not up to snuff or writing skills not up to snuff. How do you handle that?
Actually, we have technology now that can help. In the old days, I would have said get out a tape recorder, but you can also use a cell phone that has the ability to tape audio or movies or whatever, and have the family or the patient record the conversation in some way so that they could play it back and get the contents back.
Yeah, that makes a lot of sense. I think I even referenced that in some other episodes where my wife had surgery, and we recorded the physical therapist teaching her exercises because the handouts she had were kind of hard to follow. So that does work. There's no doubt.
Yeah.
When you're in the situation where, let's say you're in a situation where there are no handouts, the patient is a little reluctant to take notes, and maybe they don't have a cell phone. Do you still employ things like Teach Back and other things?
Oh,
I mean,
absolutely.
how do you get through to this person?
Absolutely. Yeah. With everyone, I would use Teach Back all the time, and always ask them to repeat back to me what it is that the key messages are so that I know they remember it. And if they have a problem with literacy or they don't have the technology, and we don't have a handout to use, we might be able to take photos that we could hand to them, download something from the internet that's appropriate as per your hospital policy. And there's always the question, what would you do? What could we do to help you remember what this is? How would you normally go about remembering things? Because people have their own tricks, and maybe there's a family member they would pull in, and they have the answers already because they've been functioning in life and have to deal with issues like this all the time.
Yeah, sure, that makes sense. That even though they're in the hospital, they've had other situations where they, excuse me, had to, pardon me, where they've had to remember something just for everyday life. So this is just an adaptation of that. So yeah, it makes sense. I know in dealing with people that only are non-English speaking, many times their children are their interpreters, and sometimes their children as young as 10 or 12 are communicating with them and trying to give them the information that they need to do things. I know just from a business standpoint, I've run into that. I would imagine in the medical field that's also a truism.
It's true, but I know at my hospital it's against policy to use children as interpreters, because there's always the question of whether they will interpret correctly, whether the information, if they understand it enough so that they could say it, and if it's private and personal, and if they should be hearing it. It's just much better to have a professional interpreter whenever you can. And now I know with telephone interpreting, it's more available than it used to be.
Okay. Now, is that what you use sometimes in your hospital when perhaps if you don't have an in-house interpreter?
Yeah, we have Spanish interpreters in person, but for
Hmm.
some other languages that are more rare in this area, we will use a telephone interpreter, which is almost always available for almost all the languages that we run into.
Okay. Now, is that typically done using a speakerphone so that the nurse educator can also hear, or how is that done?
Sometimes it's speakerphone, and sometimes we have special phones with several handsets, so
Okay.
everyone can have a handset
Okay.
in the conversation.
Gotcha. Okay. That's interesting. I did not know that. That's interesting information. Okay. Any other tips on how to teach without a handout?
It's really the basic teaching. It's like what
Hmm.
is the essential content that you have to communicate. Use teach back to make sure that they understand it, and whatever way they can take notes. And sometimes in a hospital situation where you also create your own handouts, if a patient takes excellent notes that they're willing to share with you, you could use that as a basis for creating a handout within your organization
Oh,
because
gee.
it tells you what the patients see as important.
Yeah, interesting. And that falls under the heading of crowdsourcing information nowadays, what people are trying to do socially. So yeah, no, that makes a
Yeah.
lot of sense. That makes a lot of sense. Well, that's good information. Well, I want to thank you for your time today. And I will point out that your book, No Time to Teach, is available wherever books are sold. And you can find it on Amazon and other booksellers in ebook and printed form. And you can get a discount on bulk purchases for group teaching directly from your publisher at Pritchett and Hall, p-h.com. And point out that you are on the internet. Your blog is notimetoteach.com, and your Twitter handle is @notimetoteach.
I keep it
And
simple.
yeah, that's the way to do it. Um, so I want to thank you for your time and let folks know that you were certainly willing to answer comments on your blog, and you're also on Facebook and Google Plus and Pinterest. So you're out there. If they've got a question about patient education, you're there, right?
I am. Thank you.
Okay, excellent. Well, I appreciate your time today. And I want to let people know if they're interested in video on demand in a hospital environment, we provide a system called MMDS, or Medical Media Delivery System, and you can find that at synergybroadcast.com, or just look up MMDS and Google it, or Synergy Broadcast, and you'll find us. So, Fran, thanks so much for your time and attention today, and I look forward to talking to you next time.
Okay. Bye, Chuck.
Bye-bye.